You can start.
Good morning. In the last lecture of medicine, we have started with the topic AIDS. What is AIDS? Acquired immune deficiency syndrome. Acquired immunodeficiency syndrome. It is also called as SLIM disease. It is caused due to a retrovirus, that is human immunodeficiency virus, HIV virus. In problem statement, we have seen the three types of levels of HIV, that is low level HIV epidemics, concentrated HIV epidemics, and generalized HIV epidemics. Then we have seen about the incidence in India. This is the routes of transmission of HIV in India as per 2011-12. In that, 88.2% are heterosexual, 2.7% are unknown, 1% blood and blood products, 1.7% are injecting drug users, 1.5% are homosexual, 5% are parent to child. So maximum cases are due to heterosexual contact, 88.2%. And this we have already seen. Then we have seen about epidemiological features. First one is agent factor. In that agent, as we know today, it is called as HIV, human immunodeficiency virus, but initially it was called as LAV, that is lymphadenopathy associated virus, and the name was given by French scientist. After that, in USA, it was called as human T lymphotrophic virus 3, that is HTLV3. And in May 1986, the International Committee on Taxonomy gave it name of HIV, that is human immunodeficiency virus. We had already seen the meaning of HIV, that is why it is called as human, because it can live only in humans, and immunodeficiency because it causes damage to the immune system of people it infects, and it is a type of retrovirus, that is RNA virus. So it is called as human immunodeficiency virus. We had already seen this. The virus is 1/10,000th of millimeter in diameter. It is a protein capsule containing 2 short strands of genetic material, RNA and enzymes. The virus replicates in actively dividing T lymphocytes, and like other retroviruses, it can remain in lymphoid cells in a latent state, that is inactive phase, that can be activated. The virus has unique ability to destroy the human T4 helper cells, which are the subset of human T lymphocytes, and it is able to spread throughout the body. It also can pass through blood-brain barrier and can destroy some brain cells also, which leads to neurological and psychomotor abnormalities. There are 2 types of HIV virus, HIV-1 and HIV-2. The virus is easily killed by heat, and it is readily inactivated by ether, acetone, ethanol, and beta-propiolactone. But it is resistant to ionizing radiation and ultraviolet light. Then second epidemiological factor is reservoir of infection. So the reservoirs are cases and carriers. And source of infection, the virus has been found in greatest concentration in blood, semen, and CSF. and lower concentration have been detected in tears, saliva, breast milk, urine, cervical, and vaginal secretions. Then host factors. Age. The most cases have occurred among sexually active persons aged 20 to 49 years. Then sex. In Africa, the sex ratio is equal. In North America, 51% of cases are homosexual or bisexual men. And in certain sexual practice, increase the risk of infection more than others. For example, multiple sexual partners, anal intercourse, and male homosexuality. And higher rate is found in prostitutes. High risk groups, male homosexuals, bisexuals, heterosexual partners, intravenous drug abusers, transfusion recipient of blood and blood product, hemophiliacs and client of STDs. Then we had seen about immunology. I will skip it. Then we had also seen about mode of transmission. The causative virus is transmitted from person to person, most frequently through sexual activity. And the basic modes of transmission are: first is sexual transmission. So AIDS is the first and foremost sexually transmitted disease. Any vaginal, anal, or oral sex can spread the AIDS. Then we had already seen blood contact. AIDS is also transmitted by contaminated blood transfusion of WBCs, platelet, factor VIII, 9, which are derived from human plasma. Contaminated blood is highly ineffective when introduced in a large quantity directly into the bloodstream. And the risk of contracting HIV infection from transfusion of unit of infected blood is over 95%. Then maternal to fetus transmission. HIV may pass from an infected mother to her fetus through the placenta or to her infant during delivery or by breastfeeding. So in the absence of any intervention, rate of this form of transmission can vary from 20 to 25%. But this can be prevented entirely by antiretroviral drug prophylaxis, elective cesarean section before onset of labor and rupture of membrane, and by refraining from breastfeeding. There is no evidence that HIV is transmitted through mosquitoes or any other insect. Casual social contact with infected person, including within households or by food or water. Then incubation period. While the natural history of HIV infection is not yet fully known, current data suggests that the incubation period is uncertain. It can be from few months to 10 years or even more. From HIV infection to the development of AIDS, it can be few months to 10 years or more. The virus can live silent in the body for many years. However, it is estimated that 75% of those infected with HIV will develop AIDS by the end of 10 years. Then today we'll start with clinical manifestation. The clinical features of HIV infection have been classified into 4 broad categories. So first is initial infection with the virus and development of antibodies. Second one is asymptomatic carrier state. Third is AIDS-related complex, that is ARC. And fourth and final is AIDS. So first one is initial infection. Except for generally mild illness, that is fever, sore throat and rash, which about 70% of people experience a few weeks after initial infection with the virus. Most HIV infected people have no symptoms for first 5 years or many. They look healthy and feel well, although right from the start, they can transmit the virus to others. Even they are asymptomatic or they are not knowing that they are infected, they can transmit the virus to others. Scientists have not found as yet a way of curing them or making them uninfectious to others. So in initial state, general mild illness like fever, sore throat, rash, which is about 70% of people experience a few weeks after initial infection. But most of the HIV infected people are asymptomatic for first 5 years or many years. They look healthy, feel well, and from the start of infection, initial infection, they can transmit the virus to others, even though they are not knowing that they are infected. So they can transmit the virus. These HIV antibodies usually takes between 2 to 12 weeks to appear in the bloodstream, though they have been known to take longer. The period before antibodies are produced is the window period, during which, although the person is particularly infectious because of the high concentration of virus in the blood, he will test negative on the standard antibody blood test. So during window period, even though he is infected, he will test negative on the antibody blood test, because this blood test antibodies usually takes the time of 2 to 12 weeks or more period to form. So though the body's immune system reacts to the invasion of HIV by producing antibodies, these do not inactivate the virus in the usual way. This virus can produce antibodies, but these antibodies cannot inactivate the virus because they are very strong. Then second one is asymptomatic carrier state. Infected people have antibodies but no overt sign of disease, except persistent generalized lymphadenopathy. So one of the reasons for generalized lymphadenopathy is HIV. And it is not clear how long the asymptomatic carrier state lasts. It can be from few months to 10 years or more than that. So in asymptomatic carrier state, these infected people have antibodies but no overt sign of diseases, except persistent generalized lymphadenopathy. And it is not clear how long the asymptomatic carrier state lasts. Then third one is AIDS related complex, called as ARC, AIDS related complex. A person with ARC has illness caused by the damage to the immune system, but without the opportunistic infections and cancers which are associated with AIDS. They may exhibit one or more of the following clinical signs, like unexplained diarrhea lasting longer than a month, fatigue, malaise, loss of more than 10% body weight, fever, night sweats, other milder opportunistic infections such as oral thrush, generalized lymphadenopathy, or enlarged spleen. So this persons with ARC has illness caused due to damage to the immune system. And their signs are unexplained diarrhea lasting longer than a month, fatigue, malaise, loss of more than 10% body weight, fever, night sweats, and some other opportunistic infections like oral thrush, generalized lymphadenopathy, or enlarged spleen. Patients from high-risk groups who have two or more of these manifestations, typically including generalized lymphadenopathy, and who have a decreased number of T helper lymphocytes, are considered to have AIDS-related complex. So person with these symptoms, two or more these symptoms, with generalized lymphadenopathy and decreased number of T helper lymphocytes, are considered to have AIDS-related complex. Then last stage is AIDS. So AIDS is the end stage of HIV infection. A number of opportunistic infections commonly occur at this stage and are cancers that occur in people with otherwise unexplained defects in immunity. So death is due to uncontrollable or untreatable infection. Tuberculosis and Kaposi sarcoma are usually seen relatively early. So AIDS is the end stage of HIV infection. A number of opportunistic infections commonly occur at this stage, or cancers that occur in people with otherwise unexplained defects in immunity. In this stage, the death is due to uncontrolled or untreatable infection. Mainly tuberculosis and Kaposi sarcoma are usually seen early. Even serious fungal infections such as Candida esophagitis, Cryptococcus meningitis, penicillosis, parasitic infections such as Pneumocystis carinii, pneumonia, or Toxoplasmosis gondii, encephalitis. This tends to occur when T helper cells count has dropped to around 100. So people whose counts are below 50 have the late opportunistic infections such as cytomegalovirus retinitis. So many opportunistic infections occurs like tuberculosis, Kaposi sarcoma, fungal infections like Candida esophagitis, Cryptococcus meningitis, penicillosis, parasitic infections such as Pneumocystis carinii, pneumonia or Toxoplasma gondii encephalitis, all occur due to T helper cell counts dropped around 100. And very rare opportunistic infections occur when T helper cells count is below 50, that is cytomegaloviral retinitis. Many people with AIDS are affected by wasting syndrome. As initially we have seen that it is also called as slim disease. Why? Because AIDS people affected by wasting syndrome. So in Africa, it is called as slim disease. It involves chronic diarrhea and severe weight loss. Chronic diarrhea and severe weight loss. Another condition seen worldwide is AIDS encephalopathy or AIDS dementia, which is caused by HIV crossing blood-brain barrier. Another condition seen worldwide is AIDS encephalopathy or AIDS dementia, which is caused by HIV crossing blood-brain barrier. In its last stage, AIDS encephalopathy resembles senile dementia or Alzheimer's disease. So in the Africa, it is called as slim disease because it causes wasting syndrome. In Africa, it is called as wasting syndrome or slim disease. It involves chronic diarrhea and severe weight loss. Also, the another condition which is seen worldwide is AIDS encephalopathy or AIDS dementia, which is caused due to HIV crossing blood-brain barrier. And this AIDS encephalopathy, it can resemble to senile dementia or Alzheimer disease. The tuberculosis, an alarming factor in AIDS epidemic is the increasing link between HIV infection and tuberculosis. When the immune system breaks down, as in HIV infection, tuberculosis becomes active and the person becomes contagious to others. Studies in Rwanda, that is USA, Zaire and Zambia, found that HIV positive individuals were 30 to 50 times more likely to develop active tuberculosis than the HIV negative people. So tuberculosis is very easily captured opportunistic infection by HIV patients. It is almost 30 to 50 times more than the HIV negative people. Persistent generalized lymphadenopathy. The lymph nodes are larger than 1 centimeter in diameter in 2 or more sites other than the groin area for a period of at least 3 months. So persistent generalized lymphadenopathy. Lymph nodes are larger than 1 centimeter in diameter and it is present in 2 or more sites other than groin area for the period of at least 3 months. The next is Kaposi sarcoma. It is a tumor featuring reddish brown or purplish plaques or nodules on the skin and mucous membrane. Kaposi sarcoma, it is a tumor featuring reddish brown or purplish plaque or nodule on the skin and mucous membrane. You can see in the image. It is the tumor which is reddish brown or purplish color on the skin or mucous membrane. It is endemic in Africa prior to HIV. It used to affect mainly older men. With HIV infection, it affects a wider age range and both sexes and is characterized by lesion in the mouth or gut, or lesions are generalized in 2 or more places, or rapidly progressive and invasive. So lesions in the mouth or gut, or lesions are generalized, that is 2 or more places are affected, or it is rapidly progressive and invasive. The next is oropharyngeal candidiasis. Oropharyngeal candidiasis, it is caused by common yeast fungus. It is also called as oral thrush. You can see in the image oral thrush. It presents with soreness and redness, with white plaques on the tongue and in the mouth and throat. Sometimes a white fibrous layer covering the tonsils and back of the mouth. Infection of the esophagus presents with the pain behind the breastbone. So oropharyngeal candidiasis, it is caused by common yeast fungus, also called as oral thrush. This oral thrush is present with soreness and redness, with white plaque on the tongue, in mouth and throat. Sometimes it is a white fibrous layer which covers the tonsils and back of mouth. And here infection of esophagus present with pain behind the breastbone. In cytomegalovirus retinitis, it is the inflammation of eye retina which may lead to blindness. Cytomegalovirus retinitis, it is the inflammation of eye retina which may lead to blindness. Then pnemocystis carinii pneumoniae. Symptoms can include dry, non-productive cough, inability to take a full breath, and occasional pain on breathing, and weight loss and fever. So pnemocystis carinii pneumonia. Symptoms can include dry, non-productive cough, inability to take a full breath, occasionally pain on breathing, weight loss, and fever. Next is toxoplasma encephalitis. So it is the protozoal infection in the central nervous system, presenting with focal neurological signs such as mild hemiplegia or stroke, resulting from damage to the part of the brain, seizures, or altered mental status. Toxoplasma encephalitis, it is the protozoal infection in the central nervous system, presenting with focal neurological signs such as mild hemiplegia or stroke, and resulting from damage to the part of brain, seizures, or altered mental status. Next is hairy leukoplakia. White patches on the sides of the tongue in vertical folds resembling corrugation. You can see in the image hairy leukoplakia. The next is cryptococcal meningitis. It is a fungal infection in the central nervous system which usually presents with fever, headache, vomiting, and neck stiffness. Then herpes zoster or shingles. It is the viral inflammation of central nervous system presenting with localized pain and burning sensation, followed by vesicle eruptions, that is skin blistering and ulceration. Herpes zoster or shingles. It is the viral inflammation of central nervous system presenting with localized pain and burning sensation, followed by vesicular eruptions, that is skin blistering and ulceration. You can see in the image, herpes zoster. Then severe prurigo or pruritic dermatitis. It is the chronic skin inflammation in the form of very itchy rash of small flat spots developing into blisters. Severe or recurrent skin infections, warts, dermatophytosis or ringworm, and folliculitis. It is the inflammation of hair follicles. Folliculitis is the inflammation of hair follicles. Meeting will end in less than 1 minute, so you can rejoin again. We have seen about severe or recurrent skin infections, that is warts, dermatophytosis or ringworm, and folliculitis. Folliculitis is the inflammation of hair follicles. Then HIV/AIDS diagnosis. How to diagnose the HIV/AIDS patient? So in clinical manifestation, we have seen HIV infection in 4 stages. That is initial infection with the virus and development of antibodies. Second is asymptomatic carrier state. Third one is AIDS related complex. And last one is AIDS. In initial infection, it may show the mild illness like fever, sore throat, rash, or patient may be fully asymptomatic for the first 5 years or more than 5 years. And this is the phase when they can transmit the virus to others. HIV antibodies usually takes between 2 to 12 weeks to appear in the bloodstream, and this time is known as window period. In this window period, even if patient is infected, if he will test, he will show negative result because antibodies takes to form 2 to 12 weeks. Asymptomatic carrier state. Infected people have antibodies but no overt signs of disease except only persistent generalized lymphadenopathy. And it is not clear till how long the asymptomatic carrier state lasts. Third one is AIDS related complex. This ARC is due to damage to the immune system, and it shows some clinical signs like unexplained diarrhea lasting longer than a month, fatigue, malaise, loss of more than 10% of body weight, fever, night sweats, and other some opportunistic infections like oral thrush, generalized lymphadenopathy, enlarged spleen. Then last stage is AIDS. It is the end stage of HIV infection. And number of opportunistic infections and cancers occurs in this stage. And here death is due to uncontrolled or untreatable infection. This tuberculosis and Kaposi sarcoma are usually seen in early stage. Then infections like serious fungal infections, Candida esophagitis, Cryptococcus meningitis, parasitic infections, cytomegaloretinitis can occur. In Africa, it is known as slim disease because it affects the muscular system. It causes wasting of muscles. So it is called as slim disease or wasting syndrome. And it involves chronic diarrhea and severe weight loss. Another condition seen worldwide is AIDS encephalopathy or AIDS dementia. It caused due to HIV crossing blood-brain barrier. Then common infections, common opportunistic infections during AIDS in the last stage, there is tuberculosis, persistent generalized lymphadenopathy, Kaposi sarcoma, oropharyngeal candidiasis, also called as oral thrush. It is the common yeast fungus, cytomegaloretinitis, which can lead to blindness, pneumocystosis carini pneumonia, toxoplasma encephalitis, hairy leukoplakia, cryptococcal meningitis, herpes zoster, severe prurigo or pruritic dermatitis, severe or recurrent skin infections like warts, dermatophytosis, ringworm, folliculitis. Then diagnosis of HIV/AIDS. So first one is clinical diagnosis. So we have the WHO case definition for AIDS surveillance. So for the purpose of AIDS surveillance, an adult or adolescent more than 12 years of age is considered to have AIDS if at least two of the major signs are present in combination with at least one of the minor signs, and if these signs are not known to be due to conditions unrelated to HIV infection. So what is the case definition given by WHO for the purpose of AIDS surveillance? Is an adult or adolescent more than 12 years of age is considered to have AIDS if at least two of the major signs are present in combination with at least one of the minor signs. But if these signs are not known to be due to any other conditions which are not related to HIV infection. What are the major and minor signs? First is major sign, weight loss, approximately 10% of body weight, chronic diarrhea for more than 1 month, prolonged fever for more than 1 month. It can be intermittent or constant fever. So what are the major signs to diagnose clinically AIDS? Weight loss, approximately 10% of body weight, chronic diarrhea for more than 1 month, prolonged fever for more than 1 month. It may be intermittent or constant fever. Then minor signs. Minor signs are persistent cough for more than 1 month, generalized pruritic dermatitis, history of herpes zoster, oropharyngeal candidiasis, chronic progressive or disseminated herpes simplex infection, generalized lymphadenopathy. So these are minor signs. What are minor signs? Persistent cough for more than 1 month, generalized pruritic dermatitis, history of herpes zoster, oropharyngeal candidiasis, chronic progressive or disseminated herpes simplex infection, generalized lymphadenopathy. The presence of either generalized Kaposi sarcoma or cryptococcal meningitis is sufficient for the diagnosis of AIDS for surveillance purpose. Then the clinical case definition was developed to enable reporting of the number of people with AIDS for the purpose of public health surveillance rather than the patient care. However, for the purpose of individual case management, it is useful to be able to diagnose whether illness is related to HIV infection, that is symptomatic HIV infection, because clinical manifestation can be reliable indicator of underlying HIV infection. Overuse of HIV testing is avoided. Testing is used to confirm suspected HIV infection rather than as a diagnostic tool for the first instance. A patient with suspected HIV infection can be counseled about having an HIV test, the implication for them and their sexual partners, self-care, and for nutrition. So counseling is required for HIV test. Many HIV-related illnesses can be treated, improving the patient's quality of life. Certain drugs, such as thiacetazone, caused severe side effects in people with HIV infection and should not be prescribed for them. In children, the case definition for AIDS is fulfilled if at least 2 major signs and 2 minor signs are present, and if there is no other cause of immunosuppression. In children's major signs, weight loss or abnormally slow growth, chronic diarrhea for more than 1 month, prolonged fever for more than 1 month. Minor signs includes generalized lymph node enlargement, oropharyngeal candidiasis, recurrent common infections, for example, ear infection, pharyngitis, persistent cough, generalized rash. Confirmed HIV infection in mother counts as a minor criteria. Then expanded WHO case definition for AIDS surveillance. For the purpose of AIDS surveillance, an adult or adolescent more than 12 years of age is considered to have AIDS if a test for HIV antibody gives a positive result and 1 or more of the following conditions are present, like 10% body weight loss or cachexia with diarrhea or fever or both intermittent or constant for at least 1 month. Cryptococcal meningitis, pulmonary or extrapulmonary tuberculosis, Kaposi sarcoma, neurological impairment that is sufficient to prevent independent daily activities and which is not known to be due to conditions which are unrelated to HIV infection, for example, due to trauma or cerebrovascular accident. Then candidiasis of the esophagus, which may be the presumptively diagnosed based on the presence of oral candidiasis accompanied by dysphagia, clinically diagnosed, life-threatening or recurrent episodes of pneumonia with or without etiological confirmation, and invasive cervical cancer. Major features of this expanded surveillance case definition are that is requires an HIV serological test and includes broader spectrum of clinical manifestations of HIV, such as tuberculosis, neurological impairment, pneumonia, and invasive cervical cancer. This expanded definition is simple to use and has higher specificity. Next part will continue in next lecture. If any doubt, you can call me or message me personally. Thank you. You can leave the meeting. Thank you.